Hello, I'm Berhane with the Center for Multicultural Health, and today I have a very special guest with me. Can you introduce yourself and give a brief introduction of the Center for Multicultural Health?
Sure. I'm Shelly Cooper-Ashford, and I'm the Executive Director of the Center for Multicultural Health. We're a nonprofit, community-based program located in the central area of Seattle, and we provide health education, screenings, testing. To address disparities within communities, we offer a set of services that help people understand how to access healthcare systems and do preventative health care.
And can you explain what United for Healthy Communities is and how it came about?
So United for Healthy Communities is one of the programs of the Center for Multicultural Health, and it provides education and HIV screenings and testings for people who are of African descent. And we have been doing the program now for about 8 to 10 years, I think. So the way it came about was actually we responded to an RFP through Public Health Seattle King County, who was looking at doing some HIV interventions in the foreign-born Black community. So we responded and put together a great proposal with good staffing and a great concept, and so we were funded.
Great. And so, what is the goal of United for Healthy Communities?
So the goal of the program is to really do education in the foreign-born Black community around HIV and to try to prevent people from contracting it, and to actually, if people are actually test positive, to get them into care as soon as possible.
Okay. So, who is implementing the program?
So we have two staff. We have Solomon and Segalesi.
Yes.
Okay. And Tina Abdulaziz.
Okay. And what are some problems you've encountered when implementing the program?
So really one of the biggest problems in addressing HIV in communities of color is really around the stigma around HIV and people not wanting to talk about it, not wanting to be tested for it, and think that it's a problem that doesn't actually involve them. A lot of people also, they want to basically just get their healthcare needs met when they have an emergency. They don't really want to do preventative screenings and testing. So that's sort of like one of the problems. The other problem is really, as you heard, so I have two staff people who implement the program, and that really is not enough for as large as the communities are to really make a good effort in eliminating the issues in the community.
Yeah, because there's a vast community here of
Right.
East Africans and just Africans in general.
Exactly.
And what resources does United for Healthy Communities provide?
So right now, essentially, education, they can help people put together health fairs. They've been actually giving away home test kits in the community as of late, and that's gone over really well. And then they do screening and testing.
Okay. And how does the program reach out to community members?
So, and I think in a variety of ways, but it's really through outreach, but they have over the years done it in different ways. They've actually used sort of like the taxi cab drivers to spread the word. They work with other associations, different community groups, mosques, churches. So they try hard to really reach out into the community through outreach and education.
Okay, that's great. So that concludes the segment. I want to thank you, Shelley.
Thank you. Thank you so much for doing this too. It's really great.
Thank you.
All right.
Hello, my name is Berhane, and I'm a volunteer with the Center for Multicultural Health, and today we have a special guest with us. Can you introduce yourself, where you work, and your profession?
Thank you. My name is Martin Ndegwa, and I work with Neighborhood House. Specifically, the program is called Project Handle, and we are located at the Navos in Berhane. My title there is Community Health Associate, And what we do is that we provide HIV testing and counseling as well as hepatitis C. We provide referrals and link to care to patients on need basis.
Okay, great. And can you further explain your work with HIV, like what you do?
My work with HIV actually spans over a period of 10 years plus. And I've worked with different agencies and organizations. I've worked with People of Color Against AIDS Network, Berhane. I've worked with Public Health, Seattle King County, and I've worked with the University of Washington. Currently, as I said, I'm working with Neighborhood House, and what we do now is we are providing, as I stated earlier, HIV testing and counseling to the targeted population that I did mention, the foreign-born blacks, African Americans, and the Hispanic community. So what we do is that our work is pretty much guided by our funder, as you might know that. And so we are required to provide a health survey and screen and then provide the HIV testing and then provide link and care and then provide referrals for folks who may need more than just an HIV test. So what we do is that since we are co-located at the Navels in Berhane, we're able to refer our clients